I'm Alexa.
I'm Julia.
I'm Nicole, and our disorder was substance abuse. According to the National Survey on Drug Use and Health, 19.7 million American adults aged 12 and older battled a substance use disorder in 2017. Crouch and Wagner defines substance abuse as being maladaptive pattern of substance use which results in recurrent and serious life consequences and are directly related to the repeated use of the substance. More specifically, substance life consequences can be social and interpersonal problems, neglect, legal issues, and aggressive behavior. Clients with substance use disorder are at greater risk of developing chronic health conditions such as cirrhosis of the liver, AIDS, cardiovascular disease, hypertension, cerebrovascular accidents, diabetes, and depression. Unfortunately, the biggest factor that prevents treatment for substance abuse is denial.
Okay, so on to assessments. Some commonly used assessments for substance abuse include the NIDA drug use screening tool and the CRAFT screening tool. The main difference between these two assessments is that the NIDA is used for adults and the CRAFT is used for adolescents. So for some more information about the NIDA, it stands for the National Institute on Drug Abuse, and this screening tool is used for strictly patients 18 and older. Using this tool, clinicians ask a series of questions that identify risky substance abuse in adult patients. The NIDA tests for alcohol, tobacco products, prescription drugs for non-medical reasons, and other illegal drugs. This screening enables clinicians to do a few different things with their clients, and one of these is identify drug use early and prevent the escalation to addiction. Another thing it enables clinicians to do is increasing awareness of the interaction of substance abuse with the patient's medical care, including potentially fatal drug addictions. And lastly, it identifies patients in need of help and refers them to a specialty treatment. So that way clinicians can see what patients need help and we can refer them to the right place to go. So the CRAFT screening tool. This is a short clinical assessment tool that screens for substance-related issues strictly in adolescents. And it is developmentally appropriate for adolescents and screens jointly for both alcohol and drug use. And the word CRAFT, C-R-A-F-F-T, stands for the key words in the second section of the assessment, which are car, relax, alone, forget, friends, and trouble. And the goal of this screening is to be brief and easy to administer and score. So now on to practice settings. A few examples of common practice settings in which OTs treat patients struggling with substance abuse include residential facilities, mental health outpatient clinics, and physical disability settings. So for residential facilities, these include assisted living facilities for senior citizens, which are a very common population that struggle with substance abuse, so we felt that this was important to include. Sober houses and partial hospitalization programs, which partial is more for patients who are more seriously struggling with substance abuse issues and need a more inpatient type of treatment. Mental health outpatient clinics, this is another example of a practice setting. After detox and inpatient treatment, most people will graduate onto an intensive outpatient program or an IOP. These programs consist of group therapy, individual therapy, and medication-assisted treatments. IOPs enable clients to continue working and/or enjoying their normal everyday life with friends and family. Progression through the addiction treatment process means fewer and less frequent appointments. And lastly, physical disabilities. People with disabilities like deafness, arthritis, and multiple sclerosis have substance abuse rates that are double those of the general population. Settings where patients with physical disabilities are treated for substance abuse include outpatient or inpatient detoxification, outpatient treatment, residential programs, and medication-assisted treatment and counseling. In addition to these three practice settings, there are many more settings in which OTs can treat substance abuse, but we felt these were the most crucial ones to mention in our project.
Our next topic is group treatments. According to the U.S. Department of Health and Human Services, potential group treatments that are helpful for individuals with substance abuse include social groups, cognitive behavioral groups, and psychoeducational groups. In support groups such as Alcoholics Anonymous and Narcotics Anonymous, members can invalidate each other's excuses for substance use and further encourage and support constructive change. Cognitive behavioral groups are important for individuals to change their patterns of thinking and actions that have led to their addiction. And psychoeducational groups are vital to teach about substance use and abuse and the consequences associated with it. Group treatment is overall beneficial because individuals can identify and relate with other people who have substance abuse behaviors. Those people are further along in their recovery can offer advice and support on how to overcome their addiction. And those starting their recovery can be enabled by witnessing the recovery of others, showing that it is possible to overcome. More than that, group treatment reduces isolation, which is a common substance abuse disorder.
In addition to group therapy, occupational therapists can also help this population. Drug or alcohol use may impair temporarily or permanent self-care activities and may interfere with one's life. Substance abuse can take a toll on the individual and their surrounding friends and family. Treatment after detoxification is just the beginning of recovery for substance abuse users. So it is important for occupational therapists to step in to help those who are being impacted. There are many forms of OT treatment. To start, OTs can implement coping strategies to reduce symptoms of anxiety, depression, and stress related to the substance abuse. Stress management skills are another topic OTs can help with. OTs can also implement healthy lifestyle skills such as enjoyable exercise and a well-balanced diet. Practicing proper sleep hygiene and sleep routines can help combat withdrawal symptoms from substances. Since substance abuse affects more than just the individual, family therapy is also a way that occupational therapists can intervene. OTs can help as family therapy provides support for the individual and keeps the lines of communication open with all members of the family. Occupational therapists can also teach new leisure skills, such as hobbies, routines, and things to fill their time. Anger management skills is also a beneficial form of treatment for substance abuse users. Lastly, the model of human occupation is a holistic treatment used by occupational therapists. The main goal of this model is for the client to become healthier and more adapted through an open cycle system, involving input, throughput, and output. The implementation of the MOHO model establishes client goals, life skills, and helps one discover meaningful occupations through the use of individual and group therapy sessions. It also stresses how the environment contributes to one's motivation, patterns of behavior, and performance. In order to achieve and maintain abstinence from substance abuse, it is crucial to continue research and development about the benefits that occupational therapists can have with those who are struggling with this disease. Thank you for listening to our presentation.